guys, it's Chilli Amar with Mix 107.3, and I'm here at Virginia Hospital Center again. Last year I was here for my very first mammogram, as you all came along with me. This time the Ladies for Life event is focusing on communication and why you need to talk to your family about your medical history. Right now I'm going to talk to Dr. Stephanie Akbari, the medical director for the Center for Breast Health here at Virginia Hospital Center, about why that is so important. Dr. Akbari, I know that this year's Ladies for Life event is focusing on communicating, talking with your family about medical history. Why is that so important, especially when it comes to breast health?
Well, it's important, Chilli, because if you have a strong family history of breast cancer, you may be at increased risk for developing the disease. And so we do things a little bit differently than if you didn't have a family history. So for example, we would do routine mammography. We do clinical breast exams by a physician twice per year instead of once a year. So some people see their gynecologist and a breast specialist twice a year, and that way get 2 breast checks per year. And we also caution people to listen to their bodies a little bit more so that if there is a symptom, they might see a physician earlier than if they didn't have a family history. So it's important for all of those reasons.
Assuming somebody watching this says, oh, I already know my family history. No history whatsoever of breast cancer. Rock on, I'm in the clear. Is that an accurate assessment at all? I mean, how does the percentage work, those who have breast cancer actually having had history of it?
Right, well, there are 2 things about that particular problem. One is that about 60 to 65% of patients who have breast cancer don't have a family history. So just if you have no family history doesn't mean you're fine and you're not going to get breast cancer. The second part of that is you may think there's no family history, but you may not know for sure. In other words, not everybody talks about this. Sometimes within a family there's fear talking about this. Sometimes there are cultural reasons not to discuss it. So oftentimes what I do here is patients who are diagnosed with breast cancer later find out that they had an aunt or a grandmother who had breast cancer, but nobody talked about it.
What would you ask? I mean, how does that conversation even begin? I mean, you sit down with your mom or your aunt and you say, hey, I'm kind of worried about me, like making it about yourself, I guess, and your personal health. What are some of the questions that women and even men should be asking specifically?
Well, I think you're exactly right. If you make it about yourself and you're trying to get information to help yourself and your children or your other relatives, that is an easy way to open the door to have the conversation. And so you could say, Mom, I know we didn't really talk about these things when I was growing up, but now I'm getting older and I really want to try to take the best care of myself that I can. Is there any history in our family of any medical problems that I would need to know about that might help me as I get older?
And people who don't have that conversation, you listed a few reasons why they're so afraid or just are uncomfortable with having the conversation. Do you have any clue, like in your personal life and treating a lot of your patients, have they had this conversation and that data? What kind of a difference would it have made in some of the patients that you see?
Well, I think that people assume that if that information is present, they would know about it. So not everybody has asked the question,
right,
and they might just assume because they hadn't heard about it, it was irrelevant, right? It must not be a problem. In terms of making a difference, I think that in some situations, if people are more aware or in tune to the fact that they may be at a higher risk for breast cancer, they may not have ignored a mass that they felt. They may have come in a little bit sooner. It may or may not make a difference in the long run, but I think information is always power in this situation. And again, it all goes back to if we find breast cancer at an earlier stage, it's treatable. So we really want to get to it at an early setting.
I have a list here that I want to share that I think is really helpful in how to sort of get this thing going and collecting your medical history. One of the suggestions is to select a family member that you trust, that you can sit down with and go, okay, you know what, sis or aunt, auntie or whoever, I really want to get this information. So that's the one person that you sort of go to. The other suggestion that I thought was great is making this sort of your personal project, like a family project, like kind of like the family tree, trying to figure out, well, Uncle Bob died 6 years ago. What was it? I mean, was it just old age or was it heart disease that killed him or whatever it was that killed him? And then talk to some survivors in your family, like cancer survivors in your family, and about their journey. And finally, just sort of accept the fact that some questions aren't going to be answered, like if you're adopted, or if when Uncle Bob died, there wasn't the medical help that we have today, so really the doctors weren't even sure what it was that killed Uncle Bob, back in 1940, whatever. And I think those are really good suggestions.
I think they're excellent because it gives you a framework to start. Otherwise, it's sort of overwhelming. How would I start doing that? Who would I talk to? That's an excellent framework. And then the other important part about that is once you've done it, share it with everybody so that you can let everybody else know what you've learned and how it may help them as well.
Now, I personally don't have a problem talking with my family members about stuff like this, and I'm kind of going through this right now myself with my mother. She was diagnosed with stage 3 ovarian cancer 3.5 years ago, and it's come back a couple of times already, and I'm educated enough and obsessed with the internet enough to know that the breast cancer and ovarian cancer are part of this gynecological cancer umbrella. And my mother was recently tested for the gene mutation, so she has the gene, and I have a 50% chance of having it as well. I'm sort of going along the lines that I do carry it and taking precautions. I got my first mammogram last year, much sooner than most people are recommended to get it because I know this. I get an ultrasound, vaginal ultrasound, just to make sure everything's okay. And I've sort of got a baseline for my CA 125 for my general practitioner, just to kind of keep an eye on that. So I feel pretty good that I'm ahead of things a little bit and staying on top of things. And is there anything else that I need to be doing or need to be asking just to sort of make sure that I'm going to be okay?
Well, I congratulate you first for doing what you've done, because that's a lot.
Right.
But there's more you can do. And I think the important thing is to get tested to find out if you do or do not have the gene. There are 2 genes that we know that are responsible for breast and ovarian cancer. They only account for about 8% of people who have breast cancer. So only a small number of people who have breast cancer have one of these gene mutations. However, if you test positive, we will do your screening a little bit differently than if you tested negative. Even if you're not ready to talk about surgery that's done to prevent breast cancer, we would add an MRI to your annual screening if you tested positive. We would talk to you about whether or not tamoxifen, which is a drug that we use, would help you to reduce your risk of breast cancer. And so even if your mother had ovarian cancer and there's no breast cancer in the family, if you carry the gene mutation, you have an up to an 80% chance of getting breast cancer. So it's important to know if you are or aren't. If you test negative, hooray! You don't need the MRI, you don't need that stepped up surveillance for the breast part, you still need the ovarian part. But it really does make a big difference. And then when you get to a different part in your life, when you're able to make these decisions with respect to family, etc., then we can talk about prophylactic surgery.
All right. Well, that's a lot to ingest. I mean, you're sort of dealing with major life decisions, based on the information that you're collecting from your family. And I know that it's scary for some people. I know for some people it's very uncomfortable, but the alternative is not catching something early and not being prepared, to sort of screen for it appropriately. And that's why you're saying, and that's what this whole Ladies for Life event is about, is like, you guys, screening is just part of it. Knowing enough to tell your doctor, so your doctor's aware of what's going on with your family history, could take you on a different path than other people.
And knowledge is power in this instance, and it goes back again, as I said at the beginning, about early detection being helpful, because the earlier stage breast cancer patients are treated, they do fine. In your particular situation, if you have your ovaries removed, you won't develop ovarian cancer. You have a very, very low risk of having a problem. And if you have your breasts removed, if you have the gene, you've reduced your risk of breast cancer by about 96%.
Yeah.
So it does make a difference. And if you test negative, great.
So now you understand why it's so important to have that dialogue with your family about your medical history. I hope you take this and make it your project. Collect that information. But it's not just about collecting, it's about sharing too. So if you have knowledge about medical history, share it with your family. If you want to get information about what we talked about today, just go to virginiahospitalcenter.com.